Well, we asked you to send in your questions about Omicron COVID variant. Let's try to get some answers from our expert panel who is with me tonight. We have Professor Jeremy Brown, Professor of Respiratory Infection at UCL and member of the Joint Committee on Vaccination and Immunisation. We also have Professor Paul Hunter. He's an expert in infectious diseases and a professor in medicine at the University of East Anglia, and Dr. Sharon Raymond, GP and Director of the COVID Crisis Rescue Foundation. So you've been busy sending us your questions throughout the day. We've got our first question from Katie. Now, Katie has tweeted in to ask, although the new variant is said to be mild, it is still much more transmissible. We were just hearing there the Prime Minister confirming that. So should we be taking more precautions? Dr. Sharon Raymond, I'll come to you first.
I mean, I think we're in very uncertain territory, and it remains to be seen, exactly what the impact of Omicron will be in this country. We do know that it's very transmissible, and we do know that taking precautions in the past has certainly worked. So I think, what I would encourage people to do is to continue with the advice that we've had so far. Take the necessary precautions, think about social distancing, think about wearing face coverings and regular hand washing, good ventilation. And if you've been offered a vaccination, please go ahead and take it.
Well, we have another question from Sarah, who has texted in to ask about the self-isolation rules. She says fully vaccinated contacts have to isolate if they have contracted the Omicron variant, but not if it is Delta. So how do we know, this is a good question for everyone, how do we know which variants we have? I'll come to you first, Professor Jeremy Brown, and I'd also like Professor Paul Hunter to answer it. So Professor Brown first.
Well, the PCR test can differentiate between the Delta and the Omicron because there's two bands that come up with the Delta on the PCR, but there's only one band with the Omicron. So you can know if you have a PCR test, but of course, getting the results of the PCR test is not instant. So there's a gap where you may not know whether you have Omicron or Delta.
Professor Hunter?
Yeah, absolutely right. But I think there's also additional information. If you know that you've been in contact with somebody with Omicron, then and you go down with COVID, that's a pretty good clue even before you get the results. But ultimately, we are going to miss a lot of cases of Omicron because less than half of people who get an infection already with COVID don't actually come forward for testing. So we are undoubtedly going to miss quite a few cases of Omicron at the moment. But if you believe you've been in contact with Omicron, or if you've been told you or your contacts have been in contact with Omicron, then treat it as such.
Should everyone then be taking a PCR test regardless of what they think is, which variant they think they have?
If people are symptomatic, they should go for a PCR test. The problem is that increasingly we are seeing there are asymptomatic infections. So somebody who's got an infection may be infectious, but doesn't have any symptoms, won't even think about going for a test. And if this is a more mild infection, then again, the illness that you have might not be quite as severe enough to make you think, yeah, I should go for a test. So it's difficult.
Yeah, it is difficult. Let's move on then to a question that came into our Sky News inbox today. Do new variant symptoms differ from previous variants? Are sneezing and a runny nose symptoms of Omicron? I'll ask you that, Professor Jeremy Brown.
Yeah, I'm afraid I actually don't know. I don't think we've got clear data about the clinical syndrome associated with Omicron compared to the other variants at the moment. Unless somebody has heard from the panel otherwise, I can't answer that question, I'm afraid. That there's any obvious differences between
I think that is the problem, isn't
it?
It's such early stages. Let me ask Dr. Sharon Raymond, what are you seeing in terms of symptoms if you know that someone has Omicron?
So I think it's very difficult. I think, as colleagues have said, at the moment, there are probably many people who do have symptoms, but we don't know, whether they've got Omicron. So it is, it can be challenging to distinguish, but there are a range of symptoms, and we know that there are a range of symptoms, although the most common ones are the fever, the cough, the persistent cough, and the loss or change of taste or smell. But it's not necessarily what's reflected in the findings in South Africa, but all that remains to be seen in terms of what the most common symptoms are with Omicron. Obviously, I would just say to patients, to people, if you are experiencing symptoms which may be COVID, then please do get tested. And that applies also to household contacts who need to have the PCR test rather than the lateral flow test.
Okay, another question that's brought in by email from Sharon. Straight to the point, is Omicron more deadly than other variants? Professor Paul Hunter?
Well, it depends what you mean by that. In terms of an individual person who gets infected, probably not. And indeed, the evidence from South Africa is that even after people go into hospital, at the moment, when people go into hospital, they are less likely to be more severely ill than and become less severely ill than people who go in with, say, Delta. But that's translating that more globally, and particularly into the UK setting, is more difficult. Even if the virus itself is less severe and less deadly in an individual, if we have many more infections, that will still push up the incidence of severe disease and death. So I think that's really what we desperately want to know at the moment, and it's still going to be a few weeks away before we can answer that any more clearly than I've just attempted.
Professor Brown, do you have anything to add to that?
Yeah, I mean, you have to bear in mind that the past 3-4 months, rather unusually, I think, the incidence of infection has been bobbling around about, there's about 1,000 deaths a week, something like that. About 5% of the beds in the hospital are occupied by people with COVID. And that's just about copable with. We can just about, in the NHS, deal with that. If you double the number of infections, then that will go up. And even if they're mild, that'll put an immense amount of strain on the NHS. So the real concern is that actually just the sheer numbers of people ending up in hospital, if the infection rate goes up in the community, will be a significant, a very big drain on NHS resources, and take a lot of time up and lead to a situation where it could potentially lead to a situation which we were in at the beginning of the year, where the hospitals have to dedicate a very high portion of their resources to looking after people with COVID. Even if the illness itself is not as severe as it was in January and the death rate will be lower, it could be a big issue for the NHS.
Right. We've got a question from Sandra from Gosport. Give me a second, and I'm coming to you, Dr. Sharon Raymond, actually with this question. Perhaps you can answer both at the same time. So this struck me because actually we heard so much about shielders right at the beginning of the pandemic, didn't we? And time and again, we are reminded that there are people out there who could potentially really suffer at the hands of various variants. So Sandra is asking, until more is known about the efficacy of vaccines, should people who were previously told to shield be extra careful? I will ask you, because presumably that's a lot of your patients, Dr. Sharon Raymond.
Yeah, I think probably at this time, I would say that would be wise, but obviously each individual should take the advice of their own GP, in terms of their level of risk and in terms of any kind of additional steps they need to take. So that's to be judged on a case-by-case basis. What I will say also in relation to the previous question is that, of course, people being very sick and deaths are one element of this, but we need to also be mindful of the fact that many people who may even have quite mild disease do go on to develop long COVID. And so, that's why it's absolutely, crucial that we just take the necessary steps to make sure that people are adequately protected, that we protect ourselves, and by protecting ourselves, we're also protecting others.
Professor Jeremy Brown, a question that's come into us on WhatsApp. Why do I need to isolate for 10 days if I am double jabbed and boosted?
Yeah, okay. I guess the answer to that question is that with Omicron, we don't know how likely, even after 3 vaccinations, you are, whether infection is still the likelihood of getting infection, if there's a lot of infection around, it's still possible that the infection can break through. We expect that after 2 doses, Omicron will be able to break through that in quite a high proportion of people and cause infection, mild infection mainly. After a booster, we would hope that is much reduced, but it's still possible, unfortunately.
OK, we have had a message from Ewan Stokes. He's asking about the government's travel measures. I think a lot of people have been querying these, haven't they, over the last few weeks and days. It says, with the new variant being spread through community transmission now, as we know is happening in the UK, what are the benefits of red listing countries? I think that's fair. I guess a lot of people are thinking, well, hang on, if it's already within the community and that's how it's being passed on, why do we need to stop people coming into the country?
Is that a question for Paul?
It's a question for Professor Paul Hunter first, I guess.
Right, OK. Well, yeah, I mean, the problem with border restrictions generally is that they don't last very long. They never really stop the spread internationally of infectious disease, although they can delay the spread. But once the infection is indeed spreading within a country, then closing your borders has very little additional benefit in reducing the number of infections spreading in the country. And indeed, potentially, as the World Health Organization has pointed out, could have negative consequences because the countries around the world who may in future get new variants might, because of the fears of travel bans and economic implications, then ultimately keep quiet about the new variants that are occurring on their patch and stop sharing information, which would be very negative for the rest of us in terms of controlling this pandemic globally. So personally, I think I would see very little value in continuing with border restrictions.
Professor Jeremy Brown, do you agree, disagree? Have something to add?
Okay, so I think when a variant is identified in a country, then the closing the border is for 2 reasons. One is to actually give you time to get some information about that variant and whether it's an issue or not. And the other is to try and to prevent spread occurring from that country, and for you to establish whether that's a significant issue. Now, we're sort of, I think I would agree with having put in the travel bans initially while we try and work out what's going on. But once you know that the infection is established in a country and spreading rapidly within a country, within the community, without being introduced every time by somebody coming from abroad, then the benefit of maintaining the travel ban at that point becomes obviously much less. So it's a sort of thing that you have to do when a new variant appears, but perhaps row back on at some point when it's clear that either the new variant is not an issue, which actually, unfortunately, Omicron probably is an issue, or that the infection has now established in your country, and by bringing in extra cases from abroad, it's not necessarily going to stimulate the spread any faster. Now, we're in a game of a sort of a speed game here, right? So we need to get the booster jabs in, and they'll be in by the end of January, perhaps, in most of the adult population who'll be accepting them. And if you could delay Omicron arriving or causing a big wave until the end of January, anything that does that is great. The question is whether we're past that point or not. And I have to hand over to the epidemiologist to answer that one, because I don't know where we are, really.
Yeah, it's an interesting insight, isn't it, to how these decisions get made and how much you have to weigh up from your position of expertise. Dr. Sharon Raymond, Shah from London has WhatsApped us to say, I'm a 17-year-old that goes to college, and recently there have been 4 positive cases near me, and no one is sure if it's the new variant or not. It seems to be spreading rapidly around the school. So what advice is given to schools, and should the entire class isolate?
I think, look, for each specific case, you need to, I would recommend getting advice, calling 119, getting the relevant advice, making sure that people who've got symptoms are tested, and there will be public health advice in that area for that specific school. So I can't really comment on the situation in that specific school, other than to say, obviously, in communal areas, it's important in schools in general to be wearing face coverings. And if there are cases if there are people presenting with symptoms, COVID-like symptoms, then obviously people need to, speedily get their PCR tests and take it from there in terms of getting advice as to who should and shouldn't isolate.
Professor Paul Hunter, it's interesting, isn't it, that this is a 17-year-old going to college, worried about how transmissible is. We know it's transmissible more than Delta, in fact. Do you think that there needs to be a more nationwide, more detailed information and guidance for schools and colleges?
Yeah, I mean, I think in part the issue with Omicron at the moment is that we still don't know enough to enable us to make Omicron-specific advice very forcefully compared to the other variants. But I do believe that there is a lot of advice around for schools. The government has published such advice, and it's available on their website. How that changes with Omicron, I think, is still, how that should change with Omicron is still unclear at the moment, and hopefully in the coming days we will see more different advice and more focused, targeted advice because of the problem with Omicron. But it is still early days to be absolutely sure what we should or shouldn't be doing.
OK, let's go to a question from Mike, who's in Norwich. And he says, if Omicron becomes the dominant strain, will it help build antibodies against more dangerous variants? Professor Jeremy Brown, I'll go to you for that, please.
Oh, yeah, so the optimistic scenario, and we don't know whether this is going to be true or not, but the optimistic scenario is that Omicron doesn't cause severe disease, therefore it's much less likely to kill you, but can replace Delta that does kill you as the dominant variant in the country. And that would be a sort of positive thing, I suppose. But it's a very optimistic picture, and I suspect it's not going to pan out quite like that. And I suspect that Omicron is likely to cause severe disease in susceptible people who are not vaccinated and those whose immune system means that their response to the vaccines is weak. And they get breakthrough infections despite being vaccinated even 2 or 3 or even 4 times. So that's the elderly and those who have immune diseases. So yeah, there is an optimistic sort of sunny uplands which could be the case, but it may not be the case. In fact, most likely it isn't the case.
Right, thanks very much indeed. We're going to have to leave it there. Professor Jeremy Brown, Professor of Respiratory Infection at UCL, a member of the Joint Committee on Vaccination and Immunisation. Professor Paul Hunter, expert on infectious diseases and Professor of Medicine at the University of Anglia, and Dr. Sharon Raymond, GP and Director of the COVID Crisis Rescue Foundation. Thanks very much indeed for your insight and for answering all our viewers' questions. Thank you.